This is a recording of our webinar explaining the purpose and process of Education, Health and Care, or EHC, needs assessments. The webinar was co-produced with parents and multi-agency practitioners in Suffolk and is divided into sections which match the main questions which they wanted answered. This recording will explore the purpose and threshold of an EHC needs assessment and when one might be requested. We'll look at who can request an EHC needs assessment and how a request can be made in our county of Suffolk. We'll explain the options families have if they receive a refusal from the local authority, or LA. We'll go through what happens if an EHC needs assessment is agreed and how you and your child are involved. And we'll explain what happens at the end of the process. This video is time-stamped and chaptered, so if you want to watch just a part of the recording, you can scroll your cursor along the bottom of the video. The different section headings will appear as you scroll until you find the section you want. Throughout this recording, we will give references to the law, to the Children and Families Act and SEND regulations of 2014, and we will refer to the statutory guidance which relates to the Act, the SEND Code of Practice of 2015. You can download this statutory guidance for free if you would like to. Chapter 9 is all about EHC needs assessments, EHC plans and annual reviews. We'll start by looking at some key points of law which underpin the Education, Health and Care process. The Children and Families Act puts a duty on education, health and social care to work together to support children and young people with special educational needs or disabilities, or SEND. So local authorities must have arrangements in place to plan and commission education, health and social care services jointly for children and young people with SEND, and they must promote the integration of education and training with health and social care. So if agreed, an EHC needs assessment involves a duty for the local authority to seek information and advice from health and social care as well as education to unpick what all the factors might be which are making it difficult for a child or young person to learn. Section 19 of the Children and Families Act states that local authorities must have regard to the views, wishes and feelings of the child, young person or adult, and their parents or those with parental responsibility. And they must have regard to the importance of them participating as fully as possible in decisions around the child or young person, and the importance of them having the information and support they need in order to participate, and to support them so that the pupil can achieve the best possible educational and other outcomes. An outcome is what everyone wants your child to be able to do with agreed support in a set period of time. Most children and young people with special educational needs will have their needs met in a learning setting through SEND support. This involves a 4-stage cycle where parents and pupils work with the learning setting to explore, agree and review the plan for SEND support together. Learning settings can also access additional advice and help from specialist education services which support settings to support pupils with different categories of special educational need. Their services cover 0 to 25 years, and a child or young person does not need a diagnosis or an EHC plan for settings to access their help. Parental permission is required for them to make a referral. If you would like to understand more about the graduated cycle of SEND support, we have lots of information and videos on our Sendias website. Each term, we offer an informal online session explaining SEND support in early years settings and in schools, and how you and your child or young person are involved. And in addition, we have video recordings on our YouTube channel of sessions exploring SEND support around a particular category of special educational need. There will be some children and young people who may need more help, which goes beyond the resources available to learning settings to provide SEN support. So what is the purpose of an Education, Health and Care, or EHC, needs assessment? An EHC needs assessment helps identify the education, health and care needs which are making it difficult for a child or young person to learn and to access learning. And they help identify the support required to meet these needs and help the child or young person achieve their goals and aspirations. It is the first step in the process of getting an education, health and care plan. The law says that a local authority, or LA, must secure or do an EHC needs assessment if it considers that the child or young person has or may have special educational needs, and it may be necessary for special education provision, which means support, to be made in accordance with an EHC plan. In other words, if there is a possibility that a child has special educational needs which may need support which goes beyond the resources available to learning settings to provide SEN support. So when the local authority receives a request for an EHC needs assessment, how will they know if your child has or may have special educational needs which may need support which goes beyond the resources available to the setting for SEN support? The SEN Code of Practice states that when a local authority receives a request, they should consider whether there is evidence that the child or young person has not made expected progress, despite the learning setting taking relevant and purposeful action to identify, assess and meet their special educational needs. The SEN Code recommends that the local authority pay attention to evidence and information of your child or young person's progress and attainment, the nature and extent of their special educational needs, the action already being taken by the learning setting, that where progress has been made, it has been as a result of a lot of help, which is in addition to what is usually provided, and your child or young person's physical, emotional and social development and health needs. And they may draw on relevant evidence from health professionals and what they have done to meet your child or young person's needs. However, these are recommendations and guidelines for local authorities to help them with their decision making. It is not a checklist or a target. There is nothing in law that says that certain steps must have been taken before an EHC needs assessment can be requested. A parent or young person or the learning setting can make a request at any time if they believe that the child or young person may have SEN which may need support which goes beyond the resources available to a setting for SEN support. Your child or young person does not need to have a diagnosed condition or have a disability for an EHC needs assessment to be requested or agreed. It will depend solely on whether there is evidence that your child may have special educational needs, or SEN, which may need support which goes beyond the resources available to the learning setting for SEN support. If a child or young person has health needs but no special educational needs, an EHC needs assessment will not be appropriate and will not be agreed. The child or young person can instead have an individual healthcare plan, or IHP, which will set out how these needs can be supported. These are different to education, health and care plans. In this slide, we've included a screenshot of just one of the pages in an IHP template to give you an idea of the information they might include. Before we continue, let's just bust a myth. EHC needs assessments do not bring more funding in themselves. However, they may identify new, previously unrecognised needs. These new needs may provide the evidence for more SEN funding. In our county of Suffolk, funding is always driven by the needs of the individual child. So who can request an EHC needs assessment? The following people have a specific right in law to request an EHC needs assessment: the child's parent or someone with parental responsibility, and this includes making a request for a child aged 0 to 5 years if they believe that their child will need extra help at nursery or when they start school. Also, a young person over the age of 16 but under 25 years can make a request, or the educational setting. However, the SEND Code of Practice says that in addition, anyone else can bring a child or young person who has or may have special educational needs to the attention of the local authority, particularly where they think an EHC needs assessment may be necessary. So, for example, a GP or a family support practitioner or a physiotherapist or a Scouts leader can contact the local authority and say why they think an EHC needs assessment would be helpful for a child or young person. In Suffolk's local authority, the Family Services Team are responsible for EHC processes, and if they receive this kind of notification, they may contact the family to get your views on this. If your child is past the end of the academic year in which they turn 16, the right to request an EHC needs assessment switches to them. The SEND Code says that local authorities and practitioners should normally communicate directly with the young person at this point. However, the SEND Code is also clear that the young person's family and parents should continue to be involved in discussions, and the young person may also ask for the help of their parents throughout the process. Many parents ask our service about situations like this, where their child has missed a lot of schooling, for example due to health needs, and they will need a lot of support to go back to learning, but they are past compulsory school age. A young person up to the age of 25 years can request an EHC needs assessment if they want to continue or re-enter education or training, and they may have SEN which may need a lot of extra help. This learning does not have to be in a formal learning environment like a further education college. The young person may want to do a traineeship or an apprenticeship or a supported internship to help them develop the skills they need for the workplace. Or they may want to develop their independence and life skills through a more bespoke post-16 program via an alternative education provider like Lapwing. It is helpful to speak to the nursery, school or college about your concerns about your child's learning before contacting the local authority. When a request is made for an EHC needs assessment, the local authority will need to contact the setting to get some more information. So you could speak to the relevant teacher or the nursery or school SENCO, which stands for Special Educational Needs Coordinator, or the person at a college who is responsible for SEN support. EHC needs assessment requests are often made by the learning setting, but as we stated earlier, a young person or parent or someone with parental responsibility can make a request too. So how can a request be made in our county of Suffolk? A request for an EHC needs assessment can be made through an online portal on the Suffolk Local Authority website. We have information about EHC processes on our Impartial Sendias website, and you can find a link to the Local Authority EHC portal midway down our webpage for requesting an EHC needs assessment. This is a screenshot of the Local Authority EHC portal. Midway down this webpage, there is a green button for starting an EHC needs assessment request and registering for a portal account. The local authority has produced some helpful guidance for families for registering with the portal and then using the online form. We would recommend that you look at this guidance first. This guidance for families includes a series of short videos explaining how to access and register with the portal and how to use it, which you may find helpful. If you would struggle to access the online portal, you can make a request to the Send Family Services team by phone or in writing using the contact details given on screen. These details are also on the EHC portal webpage. It's helpful to do some preparation first before you begin your request, as the form will ask you for information. This will include some basic details, your personal details and your child's, your contact information, your child's school if they attend one, and also who has parental responsibility. Then you will be asked for your views about your child's needs and their strengths and interests, what support has helped them so far, and what you would like to see change. We have information on our Sendias website to help you fill in this part of the request form. Each of the blue bars refers to a question on the form, and if you click on a bar, it opens a drop-down with tips and suggestions for what to think about, which you may find helpful. Your child or young person's views are a really important part of the request form, as this process is all about them. The form will ask you about your child's worries about school and their learning and what they find tricky. It asks what they are good at, what they enjoy, what their hopes are for the future, and what needs to happen to help them to achieve their goals and aspirations. Some children or young people may find it easier to record their views and feelings, for example, using their mobile phone. A recording can be emailed separately to the Family Services team. You will be given an email address once your request for an EHC needs assessment has been lodged. So you will need to say on the form that your child would like to send in a voice recording later. We have links to a number of person-centered resources on our Sendias website which may help your child or young person to share their views and which could also be sent in separately. Or a young person might find it easier to take and email photos of what helps them best. On screen includes examples of resources which have helped a young person with sensory processing needs, like a weighted lap blanket or ear defenders and calming worry stones. In addition, you can email the Family Services team copies of any relevant information which may support your request. For example, this might include school behaviour support plans or reports, exclusion or suspension letters, letters of diagnosis or other professional reports, or perhaps a statement from a person who has helped your child or young person to learn a skill outside of school. As we mentioned earlier, once your request has been lodged, you will be given an email address which you can use to send in additional information. Once a request for an EHC needs assessment has been made, what happens next? What can you expect? This chart shows the 20-week time frame for the whole EHC needs assessment process as set out by the Children and Families Act of 2014. When you make a request for an EHC needs assessment, you trigger the first stage in this process. This slide shows this first stage. Week 1 starts when the local authority receives the request for an EHC needs assessment. There then follows a 6-week time period when the local authority gathers the views of you, your child or young person, and the views of the educational setting to help them decide whether an EHC needs assessment is appropriate. they must tell you by the end of week 6 if they are going to do an EHC needs assessment or not. If they refuse, they must give their reasons and explain that you have the right to go to mediation and to appeal if you wish to challenge their decision. As the send code says, the local authority must give its reasons for their decision where it decides not to proceed with an EHC needs assessment. The local authority should also provide feedback collected during the process of considering whether an EHC needs assessment is necessary, including evidence from professionals. So if you receive a letter from the local authority saying that they are not going to do an EHC needs assessment, what options do you have? Firstly, you or your young person can send in more information and ask the local authority to reconsider their decision at their next EHC needs assessment panel meeting. Or you or your young person could meet with the local authority informally at a meeting with a member of the Family Services team or through formal mediation to give more context, explain things in a bit more detail, and to help you understand more about the local authority decision. Or you or your young person could register an appeal with the SEND Tribunal. We have lots of information on our Suffolk SENDIAS website and YouTube channel which you might find helpful, including information to help you build your case and videos which explain mediation and also walk you through filling in the different sections of an appeal form. Practitioners who may be working with your child may be able to help you. Although a learning setting or another practitioner does not have the legal right to challenge a local authority refusal to do an EHC needs assessment, they might be involved in supporting you or your child or young person to gather more information to be sent to the local authority. Or a practitioner may be happy to attend a meeting with the local authority or formal mediation to help you add more information or context, and these meetings could be held virtually. Or a practitioner may agree to provide a witness statement as part of a SEND Tribunal appeal. Now let's consider what happens if the local authority agree to do an EHC needs assessment and how you and your child or young person are involved. This shows the 10-week time period for the next stage in the whole 20-week process. So this is from week 7 to week 17, where information and evidence is gathered. So who does the local authority gather this information from? There are 3 slides for this. The law says that the local authority must seek advice and information from the child's parent or whoever has parental responsibility, or the young person or young adult, from the educational setting, or if this is not available, the SEND code says they must seek advice from a person with experience of teaching children and young people with SEN, or from a person responsible for the educational provision for the child or young person. They must also seek advice and information from an educational psychologist, and the SEND code says that this psychologist should consult any other psychologists known to be involved with the child or young person. For example, some families may have paid for a private assessment. If a child or young person is vision or hearing impaired, the local authority will consult with a person who is qualified to teach pupils or students with these impairments. And if a young person is detained in custody, then advice will be sought from a youth offending team. The local authority or LA must also seek advice and information from healthcare professionals with a role in relation to your child or young person's health, and also from social care. If appropriate, this might include seeking information from children in need or child protection assessments, or information from the care plan of a child looked after, or perhaps adult social care assessments. They must also seek advice and information from any person requested by the child's parent or by the young person where the LA considers it reasonable. For example, a parent could suggest that the LA seek information from a GP or another health professional. So this is your chance to tell the Family Services team if you feel there is a person who would be able to give useful information about your child's learning issues or any health or social care needs which you think are impacting on your child's ability to learn or to access learning. The LA must also seek any other advice and information considered appropriate for a satisfactory assessment. For example, early help assessments or information from the virtual school head for children looked after. Or for children of members of the armed forces, this might be information from the Children's Education Advisory Service. In addition, where the child or young person is in or beyond Year 9, the local authority must seek advice and information about support to assist the child or young person in preparation for adulthood and independent living. So you can tell the local authority of any person who you believe has helpful information to share regarding the support your child may need to help them prepare for the 4 pathways to adulthood. Note that the legal duty is to seek advice and information. This doesn't necessarily mean an assessment. It's helpful to think of this as an information gathering process in order to assess your child's needs. And it's important to note that the SEND code says that the local authority must not seek further advice if such advice has already been provided and the person providing the advice, the local authority, and the child's parents or the young person are all satisfied that it is sufficient for the assessment process and remains current. So, for example, if an educational psychologist has done a full assessment in the last 6 months, then they may only need to do an observation or a focused assessment around a particular area of concern as part of this information gathering. At the end of the day, everyone needs to be satisfied that the information and advice is sufficient enough. So if you are not happy, then tell the local authority why you feel more information needs to be gathered. When it comes to health and social care, if your child or young person is not yet known to these services, then they may contact you and possibly the learning setting to seek advice and information. They will want to find out if you or staff feel that there are health or social care needs which are affecting your child's learning or their ability to access learning. You can tell the local authority when you send in your family views if you feel that your child has health or social care needs. If an EHC needs assessment is agreed, health and social care should then consider whether an assessment is needed. However, if you feel that your child will need a health or a social care assessment, we would recommend that you request this independently to the EHC needs assessment process. You can find more information on our health and social care web pages of our Sendius website in Suffolk. Multi-agency practitioners will provide their advice via the local authority EHC portal too. This includes sections on the views of the child or young person. For practitioners who may be watching this recording, the local authority has produced guidance for using the EHC portal. The link to this can be found above the green button for starting the request on the EHC portal landing page. We explained earlier in the recording that weeks 1 to 6 in the 20-week EHC needs assessment timeframe were for deciding whether to do an EHC needs assessment, and then if an EHC needs assessment is agreed, there is a 10-week period from week 7 to week 17 when advice and information is gathered. Before week 17, the local authority will have a good idea of whether your child will need an EHC plan. And this slide shows you the latest time when the local authority can issue a draft EHC plan. They will write to you to tell you their decision, and if they don't issue an EHC plan, then you or the young person has a right to appeal. So just to be clear, not all EHC needs assessments will lead to an EHC plan. If the assessment identifies special educational needs which the local authority feel can be reasonably met by a nursery, school or college, then they won't issue an EHC plan. A parent, carer or someone with parental responsibility or the young person will have the right to challenge if you don't agree with the local authority's decision. If an education, health and care plan is agreed, how are you and your child involved in the process? The SEND Code of Practice says local authorities must consult the child and the child's parent or the young person or young adult throughout the process of assessment and production of an EHC plan. Furthermore, the SEND Code recommends a person-centered approach, ensuring that children, young people and their parents are involved in all aspects of planning and decision-making. The SEND Code says that it should be clear how the child, young person or adult has contributed to the plan and how their views are reflected in it. As a young adult with SEND has said, "My plan is not about me without me." But we know that many young people may find it hard to participate and to share their views. The SEND Code recognises this and says that local authorities need to make sure that young people have access to support. Your child or young person may like to speak to our Sendias service for impartial and confidential advice and support, perhaps in helping them think about and share what kind of support helps them most, or in supporting them to communicate with the family services team. Or a young person might like the help of an advocate. In Suffolk, the organisation Power provides free, independent and confidential advocacy. This includes advocacy for young people with communication difficulties. Remember that what is important to your child, in other words, what they enjoy and what makes life worth living to them, might be very different from what you or practitioners may feel is important for them. For example, what good support might look like. It's really important that the EHC needs assessment and plan captures both. When it comes to bringing the plan together, you can request a meeting with a representative of the family services team. You can invite the school and other practitioners to attend, where you will have the opportunity to look at an initial draft plan, share your views, ask questions to make sure you understand, and explore and agree possible amendments. This may be a face-to-face meeting, often in the learning setting, or a virtual meeting, which your child or young person may find easier to take part in. This slide gives you an idea of the kind of questions which parents or young people may have at a co-production meeting for a draft EHC plan. Remember, no question is a silly question. An EHC plan will be a tool for you and your young person to use and refer to regularly. So the SEND Code says that what is written in the EHC plan should be in clear, straightforward language that you and your child can understand. So this will be an ideal opportunity to speak out if something is unclear or where there is jargon. The SEND Code is also clear that an EHC plan needs to be specific. For example, the recommended support should state exactly what the support is, who will be offering it, when your child will have that help, and for how long. So watch out for Weasley words in the plan, like access to, or opportunities for, or as required, which are not clear and specific enough. The SEND Code says that the assessment and planning process should be easy for children, young people and their parents or carers to understand, and should use clear, ordinary language and images. The SEND code also says that decisions about the content of EHC plans should be made openly and collaboratively with parents, children, or the young person or adult. The SEND code is clear that local authorities should support and encourage the involvement of children, young people and parents or carers by giving them time to prepare for discussions and meetings, and giving time in those discussions and meetings to hear the views of children, young people and their parents. You may find it helpful to watch our Sendias video, Drafting and Finalising an EHC Plan. It explains key sections in the plan and what to look for, and what a good EHC plan should look like. We also offer a virtual session exploring this final stage in the process every term. So just to be clear, an EHC plan can only be issued after a child, young person or young adult has gone through the process of an EHC needs assessment. At the end of that process, the local authority has to decide either to issue an EHC plan or not. It will issue an EHC plan if the child, young person or adult may have a special educational need which may need support which goes beyond the resources available to their learning setting for SEND support. If the local authority decides that your child's needs can be met within the resources and specialist advice available to the learning setting through SEND support, it will not issue an EHC plan. Instead, they can suggest a resource agreement, which is sometimes called My Plan. Although this is not enforceable under the law, it can still be useful for clarifying your child's needs and the recommended support to address those needs. If the local authority refuses to issue an EHC plan, they must explain you have a right to appeal and the legal timeframes for doing so. They must give you information about mediation and explain your right to information, advice and support. We'll finish this recording by considering how an EHC plan is finalised. Earlier in the recording, we explained that the whole EHC needs assessment process will take 20 weeks, and this slide shows you the last few weeks of the 20-week needs assessment process. If the LA decides that your child needs an EHC plan, then you will receive the draft plan by week 17. You may already have been working on the draft in a working together meeting before this point. When you receive the draft plan, you have 15 days to go through it and decide if you are happy with it. And you can contact our Sendias service if you would like help with this. In the draft plan, section I is always left blank. This section is for the name or type of educational setting. It must be left blank so that a parent or someone with parental responsibility or the young person can say what setting they would like. Then in weeks 19 and 20, the local authority must consult with the educational setting that you or your child named. That setting has 15 days to go through the information about your child and decide whether their setting is suitable for your child's needs, abilities and age, and whether giving your child a place there would be compatible, that means it would work, with the teaching of the children already on their roll, and compatible with the use of resources for all their pupils. Our online session and video, Drafting and Finalising an EHC Plan, which I referred to earlier, looks at finalising the plan in much more detail, including the process of naming a school and consulting with it. Parents and young people can suggest changes to the draft EHC plan in weeks 17 to 18. However, sometimes changes are not all agreed. The local authority can still issue the final EHC plan to keep within the legal time frame of 20 weeks. This is just a reminder that only the parent, carer, person with parental responsibility, or a young person has the right to appeal to the SEND tribunal. An appeal needs to be made within 2 months of the local authority letter which gave their decision. For most appeals, you must consider mediation. There is a lot more information about appeals on our Suffolk Sendias website and YouTube channel, and we can offer advice to help you build your case, and we may be able to support you at a tribunal hearing. You may find it helpful to watch our mediation video, which explains what mediation is, how it can help, what it involves, what decisions can be made, and what happens afterwards. This video was made by Suffolk Sendias, but every county will have an impartial and confidential send, information, advice and support service.